Welcome back to Ask Dr. Antoine. So listen, if anything is bothering you, ask Dr. Antoine. It doesn't necessarily have to be medicine. It can be leadership, because that's what I've done for the last 31 years, even though I've been a doctor. After 31 years in the military, 22 months boots on the ground in Afghanistan, I know a little leadership. I just need to learn a little more spiritual, and we can ask that too. So if you have questions, just ask Dr. Antoine. We're at the Stroke and Diabetes Center, located at Piarco Plaza, Trinidad and Tobago. Dr. George, welcome home. You know, I'm always so impressed with you. You have so much energy, and I met you in Tobago. But I'm here to tell you, you're a nurse practitioner, and listen, in Trinidad and Tobago, you're the only nurse practitioner actively seeking a license. And that's a challenge, because you know, not everybody wants you to practice here in Trinidad, right? I'm just letting you, it might be a secret. You may not know it, but not everyone wants nurse practitioners on the ground, because being in the military for all those years, in the U.S. Army, nurse practitioners and physician assistants are the forefront of medicine. They are what we call the tip of the spear, Dr. George. You having challenges with getting your nurse practitioner license here in Trinidad, so there are people waiting in line for you to see you. And most times, there's only one person preventing you from doing that. Only one individual. And I can guarantee you, most times the people aren't really, whoever's trying to prevent you aren't really invested in the people. Because healthcare is such, as you know, you have to develop empathy.
Yes.
Empathy, not sympathy, empathy. And being a soldier for many years, I know, Dr. George, I'm telling you, the reason why soldiers, there are children soldiers and young soldiers at the age of 17, 18 until you're 22, because they don't develop, the adult brain, the frontal cortex of the brain isn't truly developed until you're like 22. So you can be a crazy, raving soldier all over planet Earth and then turn 23 and turn that off and live your life. What challenges are you having with becoming a nurse? You already are a nurse practitioner. You practice where?
Johns Hopkins.
And you do what?
I run the breast center at the Johns Hopkins Bayview campus.
Isn't Johns Hopkins one of the, let me see. They like to say, I went to Georgetown, and I know what Georgetown says. Georgetown says they're the best. But I know Hopkins like to say, whenever you see those US News and World Report, they always say they're number one. But if you're from Hopkins, you probably say you're number one. Isn't that where Ben Carson worked and trained? Did he train there too?
Mm-hmm.
So that's truly one of the best institutions on planet Earth, right? And that's where you work full time? And that's where you see hundreds of patients?
That's true.
And when you come home here, it's like, nah, you can't practice here. You ain't good enough?
You know what is it? You know, this is what's kind of oxymoron here, I'll tell you. We have a lot of Trinidad and Tobago citizens that pay money for a flight, come to Johns Hopkins through the international office, come to see me. You heard me?
That's big money.
Big money.
Big money.
To come to see me. Some of them comes every 3 months, every 6 months, or every year.
Specifically to
see me.
To ask Dr. George.
Yes, because you got to understand, at an academic center like Johns Hopkins, when you go to see the GI specialists, the pulmonologists, who you're interacting with is nurse practitioners.
Yes, of course.
They leave the doctors, the specialized doctors, to actually deal with the surgeries, the interventions, and everything else. Any follow-up or minor procedures is done by the nurse practitioners and the physician assistants.
My primary care doctor in the States at Triple Army Medical Center in Hawaii has always, for the last 13 years I was in Hawaii, has always been a nurse practitioner. Like I said, in Afghanistan and Iraq, they're in a lot of the frontline bases. PAs, physician assistants, and they're saving countless lives. Countless lives.
And the other thing what is amazing, because I'm specialized in oncology, I have physician residents that I train.
Yeah, of course.
They rounds with me.
Yeah.
And I show them and teach them about breast cancer treatment, surveillance, and all of that. I have doctors will call me and email me and say, hey, I have this patient, what do you think I should do? Because a lot of physicians, they recognize they are not jack of all trades.
Absolutely.
And you have to know your specialty. And a lot of times, you interact with someone who has that specialized training. So in Trinidad now, it's been a challenge. It's been a challenge because being around the Caribbean, going to other conferences, we realized that Jamaica, Dominica, Martinique, all of
Dominica has nurse practitioners?
has nurse practitioners practicing. And Trinidad is one of the most developed Caribbean islands.
But let me ask you this. Is there a law in Trinidad that says they should have nurse practitioners?
Yes, it's been on the books
So
about
what's
3
holding them up?
years. Now, it's sad because you can't have people lead the charge of developing nurse practitioners who don't know what a nurse practitioner is. If you never work side by side with a nurse practitioner, you have no clue. Don't be, you really confused. If you think you can make a decision on a nurse practitioner and you never worked with a nurse
They
practitioner,
should ask me to make the decision.
you understand? You cannot do it. So in order to really bring that nurse practitioner profession in Trinidad and Tobago, you need to have a multidisciplinary team that is made up of nurse practitioners who's actively practicing, doctors who have worked with nurse practitioners, so you can understand the scope and practice of that professional.
So I understand that. So, but I think that's where the empathy comes in. Because if you're truly invested in the empathy for that patient, because we see patients, and I'll give you empathy things here. Let me give you empathy. Now you take and start making a doctor at age 18, and he or she is done by age 22, 23. I can tell you one thing most times that young doctor doesn't have. Empathy. They come in the room and we see it. And we see it with our colleagues. Ms. Johnson, you have cancer. Walk out. You're gonna lose that leg. There isn't an empathy that sit down, lean over,
Yeah.
touch the patient hand.
Therapeutic touch.
You know that, Ms. Johnson, where's your family? That kind of, and they teach that. Where I went to medical school, I must say, they teach that.
That's the language
The
of caring.
language of caring.
The language of caring is lacking significantly. Because if we look at a country, on the books, we are 1.3 million, but we know we got tons more people in here, in Trinidad and Tobago. We know our healthcare system is imploding. We know that. We know that the money is short. We know that there's a lot of physicians that are graduating from school and some of them can't find jobs. We know there's a lot of foreign medical professionals in this country practicing now. So we have to be very efficient and effective with the actual resources that we have here now. Or nurses for 100 years or more, I'm just exaggerating, guys. They are known to be excellent educators, teachers, and very personable with the patient. Because the model of care is a holistic care. That's according to the Florence Nightingale model, But we know medicine is very focused. So a lot of times when you're having things like diabetes, thinking of managing chronic diseases, hypertension, high cholesterol, lifestyle changes, being able to have people be healthy, nurses are excellent at doing that. So advanced practice nurses who went back to school for 2 to 3 years intensive training with clinical assessment, medication management, side effects. Remember, they have that experience that the doctor don't have because they were practicing at the bedside, giving IVs, giving medication, talking to the patient. Now you advance train them. They have more empathy. They do.
Yeah.
And that's the truth.
It is the truth.
It is the
But
truth.
Let me raise this question to you. If there aren't any nurse practitioners practicing in Trinidad and Tobago, and the University of Southern Caribbean is about to kick off their University of their nurse practitioner program next year, fall of next year, which is September-ish,
Yes.
and you're spearheading that.
Yes.
Right. How can we get a nurse practitioner who's being trained, future trained at the University of Southern Caribbean, to go in a hospital and be trained? Who is the nurse practitioner who's gonna guide them through that?
And that's why we need to act now. That's why we need to act. We need to have active nurse practitioners from the US, from the UK, coming to Trinidad and demonstrate the practice.
And you're going to do that here, the Stroke and Diabetes
I'm going to do
Center.
that here at the Stroke and Diabetes Center because we have to model the practice. The public has to understand what a nurse practitioner does. There's no guesstimation anymore. And then when we start training students next year, they can rotate clinically here and also at sites in the US as well so that their experience would be well-rounded.
Because I know that experience of being the first. I know that. So I am the only, what I've been told, I'm the only physical medicine and rehabilitation physician. We're called physiatrists, by the way,
Yes.
in Trinidad and Tobago currently. And yesterday, I had to go see a patient late at night, and I took a stroke team, meaning led by a physiatrist, myself, a physical therapist, an occupational therapist, and speech and language pathologist. And we went and saw a patient. And it's the first time in Trinidad and Tobago a stroke team, compromising of all the rehab specialties, saw a patient together and made recommendations together as a unit, as a team. That multidisciplinary teamwork is how medicine is practiced. And that's
Standard
how
of
we've all
care.
learned medicine.
Standard.
That's how we learned medicine.
That's true.
Right, in the States. Now, I'm sure they do it similarly in Canada and in
UK.
in the UK. But their guidelines may be a little different, but at the end of the day, it's always the patient-centered healthcare, right? So, case in point, again yesterday, now that was the first for Trinidad and Tobago, and we're going to continue to do that. Now, trying to convince the leadership this should be implemented in every institution, and we're going to have to push that, but it will be implemented. I saw another patient yesterday. Obviously, I can't give names. Discharged from the hospital, right? Had a stroke, young woman, swelling from her leg, from her hips to her toes.
Discharged from the hospital.
Discharged from the hospital. So from the moment I saw that patient, I know that patient had a stroke, been on her back for three weeks. What are you thinking? Any first-year medical student, any first-year medical
DVT.
student that I know, if I miss that question as a medical student, first year, second year, guess what they'll do? Georgetown will not have, they won't put their name on my, that is something you can't miss. So I told the family, I says, Miss whatever, I'm not doing anything until we get a venous Doppler. Lo and behold, 2 big old blood clots in the leg, not on the appropriate medication. That's where the empathy comes in. You have to be curious, right? We're not here to beat up on the medical system, on the individuals per se, because we know from any medical system, being in the military, they're always looking for what? Root causes of anything.
Yes.
Anything that goes wrong. Being in the U.S. military, the ship runs aground. Yeah, the captain might get fired, but they're always looking for what? Root cause
analysis.
Root cause so it doesn't happen again.
That's true.
And I can tell you, rarely it's ever an individual's fault. If a nurse gives the incorrect medication, is that truly the nurse's fault?
Yes, it is.
Yeah? But you can look back and go back and back and back, and it's usually a systematic problem. 9.99 times out of 10, and it can start even from medical school.
That's
I'm
true.
telling you, a lot of these problems, this is my personal opinion, starts from how medical students are selected, at the age they're selected. What are your thoughts on that?
You know, I don't want to bash the medical system at all, but one thing I admired with the medical practice in the US and in the UK, when students come out of medical school, they have a couple, maybe 2 to 4 years underground working side by side in a hospital setting, getting their experience before they are allowed to practice independently. I understand, you can correct me, that is not happening here in Trinidad and Tobago. So there we have people who may be afraid to even touch the patient because they didn't have experience examining the patient before you put them independent to see a patient.
But they've been doing this of course they can get it right. They've been doing this for 100 years, so.
But it's not working. Yeah. So why continue with a process that's not working? We like to be very progressive. We were taken off the third world list because of our GDP. So now we look to America and UK as a standard. So why don't we want more? I keep saying that we are one of the countries with the highest literacy. You know,
99%, by the way.
literacy. I mean, we do physics, science, maths. We are excellent at it. But why can't we be literate enough to understand that our healthcare system needs to be improved? But it's not one magical person can do it. It's the leadership has to decide that, hey, you know what we've been doing for years is not working. Our people, our population are dying, and we have to save them, because not everybody could afford to pay money to fly out to Miami or go to MD Anderson to get treatment. And if you think because you can do it, it's okay to keep the system that way, that is selfishness. You know, so we have to understand that we need to train, we need to mentor doctors. A lot of the early young doctors need experience on the floor. And actually nurses could be their great experience.
Well, my nurse in the ICU, I wanted to do family practice, and I did 2 years of family practice at Howard during residency, and I was like, I think they work nights and weekends. I don't want to do that.
Yes.
but I'll tell you, something needs to change because our people are dying. I did an outreach with Hands International this weekend, and there are people walking around with blood pressures, Dr. George, so high that you just don't see these things in the States. Blood sugars are 500s. The lady told me, I like my blood sugar at 500. I said, why? She said, I feel good. And when it dropped to 150, I just feel bad, so I ain't taking my medication. I like it at 500. But we'll save that thought, because we'll be right back with Ask Dr. Antoine.